Hi friends and welcome back to Padashetti'S Pulmonology. Today is basics of chest X-ray part 2. We had done the basics of chest X-ray part 1 last time. So before seeing this video, please have a look at that video. It is important. Okay, coming to the part 2, here we will study how to begin and end reading of a chest X-ray. Okay, these are the 10 basics points which we will go through. Starting from trachea, upper mediastinum, hilum, lower mediastinum, diaphragm, costophrenic and cardiophrenic angle, pleura, upper mid and lower zone, soft tissues and bony structure. Either you can go from 1 to 10 or you can go from 10 to 1. Either inside out or outside inside. I prefer inside outside. Okay, first we go with trachea. This is trachea. Before this you have to see for all those things. Okay, name, date, time, exposure, tilt, rotation. Okay, and then come to this one. This is trachea. And then comes the paratracheal stripe that compares the upper mediastinum. Upper mediastinum, lower mediastinum separated by sternal angle. Then comes the hilum. This is your hilum, where all the blood vessels, lymphatics, and nerves enter or exit and all. It is hilum. Then comes the lower mediastinum. Lower mediastinum contains heart. Okay, this is the cardiac shadow. It will be 2/3 onto the left of the vertebral body and 1/3 to the right side. Okay, and then comes the diaphragm. These are the diaphragm. Then comes the this is the your cardiophrenic angle on both sides. Then comes the costophrenic on left and right side. These are the costophrenic angle. Then you have to see for pleura. Pleura see for pleural thickening, pleural effusion, pleural calcification. Okay. Initially, to begin pleural effusion, it comes at the subpulmonic level and then comes to costophrenic and then it rises up. And then you have to compare the zones: upper zones, mid zones, and palatal. How do you divide the lungs into the zones? From apex to first two intercostal spaces are upper zone, third and fourth intercostal space mid zone, below fourth intercostal space up to the diaphragm will be your lower zone. Okay, a normally fully inspired X-ray will contain up to 6 intercostal spaces. Okay, and then you have to go for soft tissue. Soft tissue includes your muscles, and in females it includes breast tissue. Okay, you have to see on the side. What do you see in soft tissue? You see for subcutaneous emphysema. And then comes the bony structure. What are the bony structures? Spine, clavicle, scapula, and humerus. Okay, these are the bony structures from 1 to 10 or 10 to 2. Okay, let us do an example. Okay, let us apply it. Okay, at this point you can pause the video. I had listed all the points on the right side. You can do the differential diagnosis and write it down, and then at last you can study. You can pause the video now and then you can do. Okay, okay, let us apply all the points which are studied. Okay. Name, date and time, name, date and time. Okay, patient name Shekhar, 22 years old, male, taken on 17 February 2020 and it was on 5 p.m. Okay, okay, that is correct. Okay, fine. Part exposed: thorax and upper abdomen. Okay, projection, PA view, because clavicle are within the lung fields and scapula are outside lung fields and limbs are oblique. Rotation, yeah, it's of course it is grossly rotated. You can see the vertebral bodies are not in the center; they are more towards the left side. Then tilt, of course it's tilted to the left side. Then you have to see whether it's inspiratory or expiratory film. It looks like it's an inspiratory film and really more than 6 lips are there. Okay, these are the points. Then comes proper systematic reading, that is the trachea. Then here you can see trachea. Okay, it is for trachea to say whether it is centrally placed, laterally placed or shifted. For that rotation, there should not be any rotation. Okay, first that X-ray should be properly centered, and then you have to comment on whether the trachea is shifted or not. Here that there is no, it's not because the film is rotated. I can't say whether the trachea is shifted to the left side. Okay. Then comes you can see the trachea, and this is the carina where it divides exactly, and here you can see left side there is a cutoff. This is bronchial cutoff. Okay, and here the left side it is continuing up to the primary bronchus and then divides into secondary bronchus. Upper mediastinum, these are upper mediastinum. Hilum, these are the hilum. Lower mediastinum. Okay, lower you can see there is a right side there is a cardiac silhouette. Okay, you can't see the right cardiac border. There is right cardiac silhouette. Sorry. And then you can see there is a diaphragmatic silhouette on the right side, maintained on the left. Then there is a blunting of the costophrenic angle on the right side. Here on the costophrenic and cardiophrenic. Okay, and there you can see the pleura. There is an effusion, and there is a upper mid and lower zone. There is a whole white homogeneous opacity on the right side. Soft tissues are okay. Important catchy point you can see here. Here you can see there is a deposits in the clavicle. There is a deposit even in the humerus. Okay, these are the catchy points. It could be either metastasis. Okay. So what the differential diagnosis comes to right side pleural effusion, or it could be mass with suspected malignancy. Okay. This is how you read in chest X-ray. Thank you all for your patience listening.